Hello guys, how are you doing? I hope you're doing well. Welcome to my YouTube channel and welcome back to Talk to Your Midwife session. And today I want to talk about, I still want to continue with things that annoys your midwife, or what is that you do that your midwife really becomes annoyed of. This one, this one is so much important. Shaving. Must you shave when you're coming to labor ward? Do you prefer shaving or do you prefer to just stay with your forest? Now let's talk about this. So, my answer, if it were me, my answer would be yes. It is best for you to come to labor ward when you have already shaved. And when we are talking about shaving, I hope everyone is understanding that we are talking about shaving your pubic hair or your private part hair. That is what we are talking about. So, number one of why you should shave as a mom or as a pregnant mom is, remember, when you're pregnant or when you are nearing labor, there is a lot of discharge, there is a lot of vaginal discharge that we produce. So you can imagine when you have a bush there and then you have those sticky and mucus discharge, because those discharges, the cervical discharge or the vaginal discharge that comes out is like mucus. Okay, I know all of you know how a mucus appears. Yes, so it is mucoid. So you can imagine having that mucoid discharge around those hairs, it will stick there. So you can imagine if you're spending a whole day without taking a shower, by the time it is evening, the discharge has is stuck and stuck and stuck there, and then you will start producing some bad odor. So number one of why you should shave is because of cleanliness or hygiene. It is so much hygienic for you to shave. Now, when you're coming to labor, we have that aspect of hygiene, yes, and cleanliness. Another thing is you'll be bleeding too much. So, mean especially after delivery, you'll not have so much energy to be going in and out of the bathroom, maybe to clean up yourself. Most of the moms will just be going to the toilet. When you feel like going to empty your bladder, you go change your pad, then you come back. You don't have time to clean up. So you can imagine if you have that lot of hair, that blood will stuck and stuck and stuck there, which is not hygienic for you. Another thing is, when in case you have a vaginal tear or a cervical tear, or we have given you an episiotomy and we need to suture or to repair that episiotomy or to suture the tears maybe after delivery, we need a clean area. When we want to suture, we don't need anything that can bring in infection, and hair will be one source of infection. That is why we have to shave it so before we suture, because we don't want to introduce something inside the skin where we'll be suturing. Okay, because it will mean we are introducing infection in that area, and that will mean that even afterwards you'll just go home, and then instead of that area healing, it will start to maybe like it will just get infections because of that. So that is another reason why we need to shave. And then remember, at this moment when you are in the delivery coach, we don't have so much time to keep on shaving and all that. We want to save time because we don't want you to bleed and bleed a lot. So we are in a hurry. So you can imagine we have an episiotomy or we have a tear and we need to suture. And then here it is, our area where we want to suture, it is so much like it is not neat, it is not clean. So instead of getting into suturing immediately, we will start first start by where how where is the blade we need to shave first and all that. So we are wasting time. So you can imagine when you are neat, when you're clean, we will just go direct into that, and we don't have to waste so much time for you while trying to shave so that we can suture. And also, after delivery, you have a lot of pain. And you're so much exhausted. We want to finish up so fast so that you can go and rest. So, still, we don't want to waste all that much time to keep on shaving so that we can be able to suture you. So, it is good. I know there are women who don't like see it so much important to shave when they are coming to labor ward, but we prefer it shaved. It is so much easier and also very much hygienic, because we want to, even after delivery, when there is that, we call it lochia loss, the bleeding after delivery, we call it loss. So when you are on your postpartum period and you still have the bleeding or the lochia loss, at least it is a bit hygienic. And also, guys, you can imagine, even when you're cleaning up, when you're cleaning yourself, when you're taking a bath, it is much easier to clean up, and it will just be like itangara, okay? When you're cleaning it up, it is so much easier to clean it up. So you can imagine where you have hairs, and then there is blood that has clotted inside those hairs, and the hair is bushy. So all that struggle of trying to remove those clotted blood, it's yuckish, it's dirty, it is a dirty procedure, and it takes so much time. So it is hygienic for you as a mom to shave, both during your pregnancy, when you're still pregnant, and also when you're coming to labor ward. And it will be so much easier for you to maintain that hygiene even after you deliver. Okay, so I know a lot of people wouldn't have seen it important, but I guess now you know that it is important. And I, as your midwife, or the nurses or the doctors, they will prefer it shaved. So thank you so much, and until our next video, bye bye.